Thank you to our viewers who are tuning back into another CSE listed company update. Today, I am talking to Dr. Robert Hancock, who is the CEO of ASEP Medical Holdings. Dr. Hancock, thank you so much for taking the time to join us today. I hope you're well.
Thank you. It's a pleasure.
Great. Hey, I want to jump right into this. Tell us a little bit about the vision behind ASEP Medical Holdings. What is you and your team working on?
Yeah, so a lot of people have talked about this issue of infections. Of course, infections are very top of our mind with the COVID pandemic.
Correct.
And it's recognized that there are real problems with treatment of infections as organisms become resistant to the drugs that we have available. And so ASEP was built around that concept, and also around the concept that in the current way that people treat infections, for example, bacterial infections with antibiotics, is not working very well. There's a lot of failures with more than 1 million people dying every year just due to this resistance. So ASEP basically decided, rather than try to narrow in on the problem, they defined the problem much more broadly. So they defined it as this issue of antibiotic failure, things where antibiotics fail. And once you do that, you start to bring in situations like sepsis, which kills 20% of all people on the planet, for which the major treatment is antibiotics. So obviously antibiotics fail pretty frequently there. And also these types of infections called biofilm infections, which are kind of bacteria bound to surfaces on the body and forming these communities that are very, very difficult to treat with antibiotics. These are two really perilous situations for which we literally don't have any solutions at this stage. And so we felt that was a good space for ASEP to be in.
I love that insight. Now, I've actually been to the website, so I've read up a little bit on sepsis. But for our viewers who might not be familiar with this terminology, can you maybe dive in a little bit and talk to us about what sepsis is, why it's so important that you and your team are working to treat this?
Yeah, so sepsis starts with an infection, and it really is the body's abnormal response to that infection. So rather than responding the way it's supposed to, which is to mount a defense against the infection and kill the invading organism, the body starts to actually attack you yourself, the person who has the infection. And so this kind of dysfunctional and dysregulated immune response is what is actually involved in sepsis, and it causes organ dysfunction and organ failure. So that's what eventually kills so many people.
Got it. I appreciate that insight. Now, I also noticed, before we jump into your team and your background a little bit, I've noticed that you've recently been ranked number 4. Pardon me if I'm saying this incorrectly, but ranked number 4 microbiologist in the world by Researchcom. Is that correct?
Yeah. I was a bit surprised when I got this email saying I'm the 4th best microbiologist in the world. Of course, I don't really think about it that way, but this is for my academic career at the University of British Columbia. And I basically, I'm ranked up there.
Well, hey, congratulations for all of that hard work to be recognized there. You've got a couple more accolades that are coming out recently, but I want you to talk to our audience about your background, how you got into this, and what makes you so passionate.
Yeah, so researchers basically have to go out and find money. That's not different from companies, of course. And when we find money, we write these proposals, and at the end of the proposal is what they call the significance section. And the significance section says, if I get this money, I will do this, this, and this. And of course, in the area I work in, which is trying to deal with infections and this antibiotic failure issue, I say I'm going to try to overcome antibiotic failure. And so I decided that I would take responsibility for the significance section. And that's led me into my my other life, which is involved with companies where we're actually not just providing solutions, but actually developing those solutions commercially.
Got it. Now, what about your team? Do you want to add to some of the team members you brought on board to make this company a success?
Yes, so initially I have to talk about the team who are behind the actual research that led to the breakthroughs. That involves more than a couple of hundred individuals, 150 trainees, people who did doctorate degrees or did postdoctoral studies with me. And then since then, we've been able to amass really a wonderful bunch of individuals. We have a medical director, Rob Stanstrom, who's a physician at St. Paul's Hospital. We have a chief scientific officer, Dr. Evan Haney, who's a really good researcher in his own right. And we have a whole bunch of people who've been able to support me in the business area where I feel like I'm less strong. But those individuals, Tim Murphy, Mike Raw, and many others have really helped to provide us with tremendous impetus.
Well said. Now, 2023 has been a strong start for you and your team, just based off the news that you and your team have been putting out consistently. Can you talk to us a little bit about some of the JVs that you and your team have signed this year?
Yeah, so we've actually signed a JV with a group called C-Spring in Bahrain. This is to take our sepsis diagnostic, which we're going to try to bring to maturity in North America sometime early next year, maybe Q1 2024. That's a really aggressive development. So this C-Spring, we formed a joint venture in Bahrain that covers, and with the Prince of Bahrain, as it turns out, that covers North America and Middle East, and basically will allow us to create marketplaces in this other area. We've also signed a term sheet for a JV in China that will also allow us to develop the Chinese area. This allows us to really diversify our market potential and will bring us income in areas where we just don't have the marketing apparatus to move forwards. So that's been a lot of it, although we also have a bunch of partnerships on the other side of our company, which is developing therapies for biofilm infections. So we have a strong relationship with a US company called iFiber, and we're developing other relationships, especially in wound healing and oral health.
Okay. And your team has just recently completed a clinical study as well. Can you talk to us about that and what the process was that goes into?
Yeah. So a lot of people, when they develop a diagnostic, go in fairly blind. And that means that their formal clinical study, the one that is insisted upon by the regulatory authorities, they don't really know what the result will be. So we've performed a very large clinical study of nearly 1,000 patients now, where we demonstrated that our diagnostic assay worked really well. We've also analyzed other literature or other data sets that are present in developed by other people. So we have a total of 2,140 patients worth of data already amassed, demonstrating that our diagnostic really shoots everything else around there out of the water. So the nice thing about this is it's enabled us to move back the time where our diagnostic can be applied. So we know that it can be applied immediately if a patient hits the emergency room, or perhaps when they first go into the ICU. And early treatment of sepsis is critical because for every hour you delay appropriate therapy, there's like an 8% increased risk of death.
Oh, wow.
It allowed us to take the signature, which is originally quite large, and narrow it down to a very modest number of genes. And that makes it a lot more practical to develop. So these two things have happened because we've been able to get a large number of patients. And then critically in this large set of studies, we have data from 5 different countries and 4 different continents. So we know that our test works in diverse sets of individuals.
Wonderful. Now, for our viewers, shareholders, anyone that might be on the sidelines, what would you say is key to paying attention to what you and your team are working on at ASEP?
Yeah, so I think that the big thing is that we're dealing with extremely large and unsatisfied markets. So on the one hand, with the diagnostic area, we're dealing with sepsis. So there are 49 million people acquired sepsis. In the last year, they counted 2017, and 11 million people of those died. So it's a cause of 20% of all deaths on the planet. And we desperately need early warning diagnostics, and that's what ASEP will provide. In addition, we had a little disease I'm sure nobody's heard about called COVID-19. And COVID-19 caused 18 million excess deaths on the planet in just a couple of years. And it turns out that everybody who dies from COVID-19 died from sepsis. So sepsis is the actual cause of death. So over and above just the organism, the real cause of death eventually is this immune dysfunction, caused by that results in sepsis. So that's one side. So on the other side, on the therapeutic side, we're dealing with biofilm infections. And there was a review came out recently that said this is a $385 billion problem to the medical system worldwide. Really, there's actually no approved drugs for this area. This is a great unsatisfied market into which ASEP can enter. So we've got these large unsatisfied markets that I think we're addressing, and that gives us just massive potential.
And so where can our viewers go to read up more, not only on sepsis, but to read up on your background, the team, and obviously sign up for your upcoming press releases so they can be in the know?
Absolutely. So we have a website, and if you just type in ASEP, you'll find it, or ASEP Medical. If you want to look up me personally, just type my name, Robert E.W. Hancock, into the internet. You'll find my university website that tells you all about the background and the science nerd type of stuff about that. And then if you type in that, you'll also find quite a few things that I've done along the way, television interviews and radio interviews and such like, that really will have made a huge difference.
No worries. I actually encourage our viewers to go to your website, read up on what your team is working on, to do their due diligence. On behalf of the CSE, though, I want to thank you for your time and especially congratulate you on the recent accolade of being ranked number 4 microbiologist in the world. Well, to everybody watching, you've been listening to Dr. Robert Hancock. He is the CEO of ASEP Medical Holdings. I'm Anil Mall, representing the Canadian Securities Exchange, and I thank everyone for their time. Thank you, Dr. Hancock.
Thanks so much.